right? Okay, start a whole new topic today, respiratory. So, we start off, take a deep breath. Okay? All right. We have models, as usual. This actually is described, Unit 2, page 6. Unit 2, page 6. Okay? Okay. We have the new sagittal head, and we have the old sagittal head, which I'm trying to find out whether they're going to use the old one. Previously, we only had the old one. These are brand new, so we'll see. I'm sure they're going to use the new ones. The question is, will they also use the old ones? We'll see. But anyway, they're, as you can see, quite similar. All right. So, first, you have a nasal cavity. There. And there, all right? Okay, so it's here. Okay. Now, just for review, what are these ridges? Who remembers? From 212. Oh, yeah. In there somewhere, right? These are the inferior, middle, and superior nasal conchae. Remember those? They're in there somewhere. Okay. We could even have fun with nervous system. Ooh, look at all those structures. Okay. Corpus callosum, fornix. Anyway, that's long gone. As they say, ancient history. All right, so for your nasal cavity, you have openings in and out. You have an opening in to your nasal cavity. Actually, you have two of them. You typically refer to those as nostrils. In A&P, they're called anterior nares. It's an opening. Okay? All right. Then, just like in your house, you got a front door and you've got a back door. And so there's a posterior nares, which is actually this space right there. Or over here, this space. Not that crater, but this space right here. Okay? We got anterior nares and posterior nares. Just like your front and back door. Okay? Alright. Those are pretty good. Okay. In this area, you have two structures you need to be able to identify. There's an opening to your middle ear. In the old model, it's this little crater. Here, it's this little kind of depression right there. This is called the eustachian tube, or you can use auditory tube, whichever seems easier to you. But anyway, it's right there. The eustachian tube is a tube coming in to the hole, which is the posterior nares. You also have a tonsil, which is depicted in this model. right there. This is your pharyngeal tonsil. In this model, it's right here. So you got eustachian tube or auditory tube, and you have pharyngeal tonsil. It's got a little rough surface. Okay? All right. Now, your nasal cavity, the posterior nares opens into something called the pharynx. It is this tube going down here, right here. Or, on this model, focus, come on, focus. Can't see that. There we go. This tube right here. Or this tube going right down there. It has sections or parts to it. This pharynx tube. Okay, there are 3 sections. And what distinguishes each section is that an opening comes into the pharynx at each of those 3 sections. Hence the names. So, the opening from your nasal cavity into the top of the pharynx gives you nasopharynx. Okay. Then you have an oral cavity. This is your tongue. So you have an oral cavity, and the opening in the back of your oral cavity to the pharynx gives you oropharynx, this section. And then you have this other structure here. It's called the larynx. It enters into or is connected to the pharynx. So in that part, it's called the laryngopharynx. This area. So you have the 3 parts of the pharynx. Nasopharynx, oropharynx, laryngopharynx. In the old model, Professor Alexic, in his infinite wisdom, actually marked them. So the red lines, that's naso. Then you have, although it's probably difficult to see, these are green lines. That's oropharynx. And then there's black lines. There's a second black line. Well, it's almost gone. Anyway, this area here is the laryngopharynx. Naso, oro, laryngopharynx. Okay? The pharynx will become this tube here, or down here. Oh, that's off. That's off the charts. There it is. Now we got it. pharynx is continuous with your esophagus. Your esophagus, of course, is going to your stomach, which we will visit and say hello to when we get to digestive. Okay? Good? Again, none of this is complicated. It's just what's this, what's this, what's this. There's just a lot of it. So you just have to get a handle on it. Okay? Did I miss anybody in that section? I mentioned the tonsil, right? Pharyngeal tonsil and eustachian tube. All right. They're not going to ask you any nervous system or anything like that. Don't worry. Okay? I know it's all right on the tip of your tongue. Okay? All right. You can see on either model, this is like pickup sticks. We said this area here this is called the larynx. So you got pharynx, and now you have larynx. Okay? Larynx is continuous with trachea. Trachea, of course, goes to your lungs. Okay? So the trachea is in front of, anterior to, the esophagus. You can also see, if you remember from 212, right in there is your hyoid bone. Right in there. Not your Adam's apple, above that, your hyoid bone. It's, of course, in a sagittal cut. It's just cut in half. So it's, might help if I got it out of the way, huh? I'll have to do this twice. So there's hyoid bone. Hyoid bone. Okay. In this model, it's right there. Okay. Hyoid bone. Okay. There is thyroid gland. You can't really see it in this model, but you actually can see it. Much of this is adipose. Okay, but right here is a cut through the middle part. That doesn't help because I'm pushing the screen back. Okay, right here is your thyroid gland, piece of it. Okay. And then, as mentioned, you have the trachea and esophagus. So maybe if I show it here, this right here is a piece of thyroid gland. All right. That's the second grouping. Any questions on this model? Okay. Now, we have a model of the larynx. So, we can barely see it, but here we have an actual model of this right here, which we're going to next. Okay, this is called larynx model. Okay, it has a lot of structures. They're not difficult, but there's lots of them. They love to use this model. Please be certain you can handle this. Okay, first thing is hyoid bone. Hyoid bone, right there. Okay, then there are cartilages. Cartilages are blue. Cartilages are blue. Okay, you have a large cartilage, the thyroid cartilage. This is actually what forms the Adam's apple. This point right there of the thyroid cartilage. There. It also comes up the side. Okay? So all that is thyroid cartilage. Below that, you have this cartilage, cricoid cartilage. Not only is it in front here, but it expands in the back. This is all cricoid cartilage. Sitting on top of the posterior aspect of cricoid is arytenoid. This kind of triangular shaped piece right here. It's called arytenoid. And then, let me see if I can get this. Yes. Sitting right on top of arytenoid, so here's arytenoid. There's a tiny little triangular piece on either side. Okay? This is corniculate. Just a little piece causes this bump in the back. Corniculate. And then this bump here on either side, a little bump right there and there. There's a cartilage in there. It's a little oval piece of cartilage that causes this bump. That's cuneiform. We used to be able to actually see it. We had a larger model. And one side they had the little piece exposed, but that got dropped so many times it was literally falling apart, so we had to throw it away. So we don't have one where you can literally view cuneiform. But that's the bump. If you open up this model, you have epiglottic cartilage. The epiglottic cartilage is what forms this scoop. Looks like a little scoop. Okay. Think Ben and Jerry's. Okay. A little scoop. Okay? Because this scoop is the epiglottis, formed by the epiglottic cartilage. Here, this curved area. So this whole thing right here, the scoop, is the epiglottis. And in there is the epiglottic cartilage. We all right? I'm not going too fast? All right, then we have ligaments. Ligaments are gray. Okay? All ligaments are gray. I've turned to page 7 in your Unit 2 excuse me, Unit 2 handout. Okay. Between the hyoid bone and the thyroid cartilage, you have the thyrohyoid ligament. Thyrohyoid ligament. Right there. Then between the thyroid cartilage and the cricoid cartilage, you have the cricothyroid ligament. Right between. With the other two, you need to open up. You have the hyoid bone and the epiglottic cartilage. So you have the hyoepiglottic ligament, the span-shaped structure. Hyoepiglottic ligament. And then this is actually the inner part of the thyroid cartilage. So between the thyroid cartilage and the epiglottic cartilage, you have the thyroepiglottic ligament. Right there. Hyoepiglottic ligament, the thyroepiglottic ligament. Right there. In addition, you have tracheal cartilage rings. All these blue bands are tracheal cartilages, the beginning part of your trachea. Okay? But they are not complete rings. They're only 3/4 rings, basically. So in the back, the rings do not complete. And in the back, you have the posterior tracheal membrane, which is basically a ligament too. Posterior tracheal membrane. Did I skip that? It is mentioned. There it is. It's under the larynx, trachea. So we have tracheal cartilages, the rings, and the posterior tracheal membrane. All right. Then we've already covered the scoop. The scoop is the epiglottis. It's formed by the epiglottic cartilage. Okay? This is the structure that every time you swallow, closes, right? So So all your yummies go into your esophagus, not into your trachea and into your lungs. Every time you swallow, so down it goes, the others, one behind. All right? And then, if you look inside, you have the vocal folds, true and false. Okay? They come in pairs, but the pairs are not up and down. The pairs are side and side. Okay? Not up and down, side and side. The lower, thicker ones with the cords are your true vocal folds. And then the thinner, more modest, upper folds are the false vocal folds. True, 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 false, 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 false. Okay? Side to side, not up and down. Okay?
Professor,
Yes.
which one was the epiglottis? Say.
The epiglottis is the scoop.
Oh. Mm-hmm.
This thing. Right? Maybe you like Haagen-Dazs better than Ben & Jerry's. Who knows? Both are highly acceptable. Okay. All right. Questions on this model? Oh, we're not done. Sorry. What did I skip? Muscles. I skipped the muscles. How can I do such a thing? Muscles are red. Okay? Muscles are red. They're also named from where they go to where they stop. Okay? So you have, oh, come on, focus, focus. Focus, 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 focus. There you go. Thyroid muscle. Thyroid cartilage, hyoid bone, muscle. Hyoid muscle. This is cricoid cartilage. It's also, of course, on this side. This muscle covers cricoid, but it also attaches at the corner edge of thyroid cartilage. So it's cricothyroid muscle. There's three of them, right? Yes. And the other one is in the back. Okay? This is the back of cricoid. This is the arytenoid, right? And you have this muscle covering the posterior aspect of cricoid, but it also attaches to this little lower corner of arytenoid. You can't see it very well, but it attaches right in there. And so it's cricoarytenoid muscle. This one. These up here you don't have to worry about, you don't have to know those. This larger one is basically covering most of cricoid in the posterior aspect is what you need. This one. Now, I think I got all these. Questions? All right. As you can see, there's a lot going on there. They love this model. Therefore, you need to have a complete handle on this. You're definitely going to see it several times. There are a lot of nice things they can ask. They're easy to ask, so that makes their life easy. So you can absolutely be certain it's going to be there in some abundance. All right, you okay with that? Because that's going to happen. All right, and last for today, okay? You hopefully have lungs. Oh no, it's not the last. There's one other thing. Okay, which is first? Nope. Gotta wait for the lungs. We're going to do the bronchial tree. Or, as they say in your handout, tubing. Okay? So, we already covered up here, this is your larynx, and we saw the first initial part of trachea, but trachea continues down until it splits. And where it splits, you have primary bronchus. Okay? Now, one side is good for what we want, the other side is not. So they typically use the left side. Left side, okay? Because the divisions are clearer. All right, so you have primary bronchus right there. You go to the next split, and in that case you get secondary bronchus. And you go to the next split. And you get tertiary bronchus. Please note, we have not gotten to the multicolored parts. Question?
Yeah, so bronchi and bronchi is the same?
Bronchi and bronchus. Bronchi is just plural of bronchus.
Okay.
You can use either one. It's fine. You got primary, the first split. After the first split, you have a second split. That gives you secondary. And when you split a secondary, you get tertiary. It continues to split, 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 as you can see, but we don't get into that. We'll show you what goes on Thursday when we look at the slide. You get the bronchioles, you get the terminal bronchus, you get the bronchioles, terminal bronchioles, etc. We'll get into all that on the slide. Okay? They typically will ask you one of these. And again, the easiest way to see it is the left side of this model. If they try and use the right side, I told my class this morning, I would change it to use the left side. It's so much clearer than the right side. Questions on this? You have to have a decent chance to get the thing right, obviously. All right? And And now, our last model. You okay with this one? Yes.
Do they always split twice? Or like, do you
Well-
always split it first?
Again, down here, you might say, well, not necessarily. Okay? That's why I kind of avoid that. Okay? Because if there's just a nice split, then it's pretty obvious. But again, if you go down and 2 and 3 and 4 things are coming off, it starts to get a little dicey. All right? Okay. And last, the last model for today is the model that you've seen before. It's the thoracic model, but this time we're going to talk about your lungs. You have, hopefully, left and right lungs. Can you survive with one lung? Yes, you can. There are people with one lung. Okay? Could have one removed for whatever reason. Lung cancer, infection, doesn't heal. It's possible. Okay? All right. So we have lungs, and they have lobes, parts, divisions. Okay? Your right lung, okay? So this is right. This is left. One way you can hopefully remember. The left has a kind of groove. That's to accommodate your heart, which is not exactly dead center in your body. It's a little bit, ever so slightly, to the left. Just a little bit. It's not all the way over here, of course. But it's just a little bit there. And the apex is pointing down and to the left. Okay? A little bit, not much. All right. So you have a right lung that has 3 lobes. And you can see how to determine. There's a kind of groove that helps you to distinguish. So this is superior, big lobe. This is middle. And not sure how you can see, how well you can see. But here's another groove right here, right along there. And so this is inferior lobe. Inferior, middle, superior, right lung. The left lobe only has 2. The left lung only has 2 lobes. Superior, here's the groove, and this one is inferior. There's no middle in your left lung. You also have coverings. There's a parietal pleura, as it's called. I'm going in the process, as I told my morning class, typically use a large torso. We're going to establish exactly where that can be seen on that model. There's some question about this, so I'm going to get it right from the horse's mouth, the course coordinator. The visceral pleura, see how it's kind of shiny surface and a little lighter? That's supposed to be the visceral pleura. It's literally hugging the surface of the lung. And there's supposedly a space in between. That's another thing I have to find out. Where the heck are they going to ask that, since they have it there? Okay? If it's on the large torso, exactly where you can see it. We'll get that to you on Thursday. And last, there's a diaphragm. It's a muscle. It's a thin muscle. It's all this down here. This muscle. It's right here. This lower edge. Okay. It begins right below your ribs. This is the bottom of your ribs. It goes in and back and down. In there. It's the divide between your thoracic cavity and your abdominal cavity. Okay, your diaphragm. And poking out here, who remembers what this is? The beginning of your what? Abdominal aorta. That makes that what? What's the first tube coming off? Don't we just love to review? What's that?
Celiac trunk.
Celiac trunk. Yes, the first tube coming off is the celiac trunk. You know these things. They're in there. They didn't fall out yet. Okay? Got to give them more time. Okay? But basically, this is the beginning of your abdominal aorta. It plows through your diaphragm, and the first tube coming off is your celiac trunk, which will give you gastric and splenic and common hepatic. It's all there somewhere. Okay? All right. Questions on any of our models? This morning, I just ended there, and we'll do the one slide on Thursday. On Thursday, you need a handout. It's on Blackboard. It's called